Hi, I'm Dr. Mike Milling. I'm here with Dr. Amy Doneen of the Heart Attack and Stroke Prevention Center in Spokane, Washington. Amy, thanks so much for being with us.
Oh, thank you, Mike. I'm glad you're here.
Now, you and Dr. Bale, Dr. Brad Bale, developed the Bale-Doneen method for preventing heart attacks, strokes, diabetes, and the like, cardiovascular disease.
Right, yeah.
And you speak to cardiologists, physicians of all types, dentists, other healthcare providers all over the country.
Yes, we do.
Internationally, and you publish newsletters, you write articles. A recent article that you had published in the British Medical Journal, one of the top medical journals in the world, talked about 5 bacteria in the mouth that cause not only periodontal disease and mouth problems, but are causative for heart attacks and strokes.
We did. We aim to really place periodontal pathogens as causative agents for atherosclerotic changes. Historically, there was obviously documentation to demonstrate that there was an association, that what goes on in the mouth can affect the vasculature system, but what that statement failed to do is prove causality. So we intended to use a model called the atherogenic triad to show how these bacteria that live in our gum line actually affect arterial wall health. And so
this is new.
It's brand new. It's brand new.
So this is new for dental patients. And but what should our patient, in 1 minute, Amy, I wanted to find out what patients should know, what dentists should know, and what other healthcare providers like cardiologists, general physicians, and others, nurses, should know. So in 1 minute, what should our patients know about this bacteria in the mouth being causative of heart attacks and strokes?
Yeah, so the bacteria in the mouth, what I want the healthcare consumer to know and the dental consumer is that what goes on in our mouths directly affects the vascular system. So it's imperative that you get into your dentist regularly. It's imperative that you get in for the cleanings with the hygienist regularly, and that home care is optimal. And if you have gum bleeding and gum loss, that is late stages of inflammation.
Right, yeah, okay. And now there are tests that we can, salivary tests, very simple, swish and spit, that we can use to determine the bacteria that are in the mouth. And find these 5, if you have these 5 bacteria.
Right. And that's one of the call outs we have to our dental colleagues is to please include gram-negative periodontal testing in the diagnostics of periodontal disease. Historically, that wasn't and remains still not part of the regular criteria, and we're just asking that dentists start looking for this, because if I know as a medical provider what pathogens are going on in the mouth, I can understand how the arterial wall might be affected by that. So it's, less than 1 minute. It's really working in partnership with the medical community and the dental community to really eradicate vascular inflammation.
I know, I'm a dentist. My mouth's pretty clean, and yet you have me take this test about every year.
Yes.
You get all excited whenever you see inflammation in my body that it might be caused by these 5 bacteria, and I've had them from time to time and had to eradicate them.
Yeah, right.
They're gone right now.
The bacteria do not care what the initials are behind your name.
Yes,
They
exactly.
just do not.
So what should the dentists know? This is fairly new, and many dentists do know about this, but more do not know than know.
Right.
What should dentists know about this?
Know that the testing is available, that it does go beyond what a normal dental insurance probably would cover, but it's the dentist and the hygienist's job to educate their patients and to offer it. Let the patient decide if they want the test or not. And if a patient has a history of a heart attack, stroke, family history, personal history of risk profiles, measuring these pathogens and understanding how to treat them is as important as dealing with lipids, cholesterol, blood pressure, pre-diabetes. It's as important as everything else.
It really is, and we didn't know that in the past.
We didn't, but we do now, so we need to measure for them.
What should other healthcare providers know, our general physicians, the nurses, the cardiologists, and others? What should they know about this?
Yeah, the biggest thing is that atherosclerosis or plaque in the arteries is an inflammatory condition. And there's lots of reasons why people might have vascular inflammation. And some of them are in our wheelhouse to treat. like cholesterol and blood pressure and insulin resistance, lipoprotein A, all of those things. But there's two major root causes of vascular inflammation that I was not trained to identify and treat, and that is periodontal pathogens and silent endodontic lesions. And that's why it's imperative that people in medicine and nursing work with their dental colleagues.
Right. Gum disease and abscessed teeth are big factors.
Not friends of the arteries.
What else should we know about that, Amy?
We should know that now the data has been published. So we now have science to demonstrate it's not just an association, but rather there's a cause and effect, meaning it's causal. These bacteria change the health of the arteries. And knowing that, then we should identify them, number one, and treat them.
Treat them and then retest
And
to be sure that they're gone.
Yeah, it's like, think about it like blood pressure. If I put someone on a blood pressure drug and don't retest the blood pressure, how do I know it works?
You don't know it works.
So if you have pathogens and you get treated, maybe a more intensive cleaning or what have you, you want to know it worked, right?
Okay.
So you just retest.
Now, how do we find more out about you and this and the Heart Attack and Stroke Prevention Center? Do you have a website?
We do. So our professional website is baledoneen.com, and that's BALE Doneen, DONEEN.com. And you can go there and pretty much, and it links to my clinical practice as well, but yeah, you can find out everything on that website.
Amy, thank you so much for being with us.
Thank you.